We had 6 patients who had died in a 24-hour period. That was in the first wave. In the second wave, I lost count.
Going home every day, it was like my prayer I just park outside the car. Lord, please get rid of all the germs that's in me.
The last 12 months has been the most difficult in the NHS that I've ever worked.
I'll never forget things I've seen and the things I've done. Never.
It's impossible to speak about the last year without talking about the coronavirus pandemic. I moved shortly before that started, before the lockdown. You're in a new place, away from family, away from friends, you're alone. Back home, everyone was like, oh my God, you left at such the wrong time. My name is Rahila Dusu. I joined the NHS in January of 2020.
My name is Sheba Phillip. I'm one of the stroke nurse consultant working for East Lancashire Teaching Hospital. And I've been in my role here since 2017.
I'm Lisa Macmillan, I'm PSA, Patient Services Assistant, and I've been with the NHS Blackburn Royal for coming up for 12 months. I worked on the critical care COVID ward. The first time I ever went on that ward, I really didn't know what to expect. Yeah, we saw it on TV, we saw film camera, going in, but to actually be there and actually see it is something totally different.
My name's Maxine. I'm a paramedic for North West Ambulance Service for the last 13 years, based in the northwest area of Blackburn. It's been the worst year that I've ever known working for the ambulance service. We would sign on at 7 a.m, you put all your PPE on the vehicle, check everything off, and then pretty much straight away your radio will go off. And you'll know pretty much it's going to be a COVID-related patient. We pretty much work 8 hours before we get a break, and then you have half an hour, and then you're back out again. The hardest thing is that thing of taking someone away from their family and thinking, you're not coming, they're not coming home, and they're saying to you, will they be all right? Will I see them again? And you're thinking, no, I don't think you will.
When I started in December, it was so busy, and my eyes was I was just like, oh my Lord, what is going on? I can't believe how bad it is.
There was a patient, a gentleman, and I think he'd come off ventilation. I'm not medically trained, but I always try, if the patient's there and I'm cleaning around, I am Lisa, is it all right to clean round? And then he's photo of his family, and I said, is this your family? And he said, yeah, well, thumbs up. So I turned it so he could see it, and I said, what a beautiful family you have. And I'm like, hang in there, keep going. And then about an hour and a half later, his family came in, and he was passing, and the scream of his daughter, that'll live with me forever, when he finally went. Humbled.
Challenging and yet rewarding. Tough.
Growth.
Traumatic.
People my mum and dad's age on there, and the kids are obviously the same age as me, and I just couldn't believe it, and that made me want to help instead of running away.
Obviously patients aren't seeing the visitors, so we've had a few end-of-life little requests. It might just be a bacon sandwich, it might just be they fancy some chips at the wrong time of the day, but if we can do it, we will do it. That's what's important. Just giving somebody a little bit of happiness with food.
My mum has been living with me, so she actually had multiple long-term conditions. So she was diabetic, high blood pressure, and she was also on dialysis. Every day, the thought that you could be taking home, it was very difficult. Oh God, sorry. And it was very real. You knew that you had to take precautions, but you also knew that as a professional you have a responsibility to your patients and out there. So you couldn't say that I'm going to shield as well because my mum is such a high risk and I want to stay at home. Even though my heart wanted to in a little bit selfishness, but I couldn't do that.
You don't want to push the staff too far, make them unwell due to having to do extra shifts all the time. So that's been very difficult. And then obviously at home it's difficult. I've got 3 children. Oh God, I'm really sorry about this. I'm not usually a crier at all.
We are worried about what it's going to be like after, actually, for the nurses, because it's been quite traumatic seeing the things that we've seen on the unit.
You're kind of going through it alone, even though the phone makes everyone seem so close, but really they're still far away. You can't see them, you can hug them, you can't, just that physical presence is missing, so that makes it hard.
The whole family ended up having COVID. All of my children, my husband, we all recovered because our health conditions was, we were not having comorbidities or anything. But when she got it and she had to be admitted, I think, like I said, as a nurse, I knew she might not be coming home. But as a daughter, I was literally praying every day that, God, if it is your will, let mom come home. When she was in those last moments of her life, in her mind, she was prepared, and her faith helped her a lot.
Yes, there's been times when we've cried, but we've also had times when we've laughed, when we've joked, and we've got through this through humour. We've got through this by working with each other, being kind and compassionate towards each other.
I have a really good team that I work with, and that's one of the things I love about working here, the team. They're amazing and they just keep going every day, despite what's thrown at them. They really are an amazing team.
The department I'm in was really amazing. People banded together.
I've seen lots of different staff members grow through this pandemic, really come out of their own, and really, developed absolutely amazingly. Really, really proud of them.
I've learned teamwork, I've learned that I'm resilient, I've learned that the people around me are resilient as well. You feel more confident and a bit more bold, like, yes, I can face anything else that comes my way, and I'm very grateful for that.
Faith. Emotional.
Bittersweet. Long. It's been a long year.